Hi, and welcome to Chamber Chat. I'm Danielle McFadden, president of the Greater Lowell Chamber of Commerce, and this Inside Lowell podcast is coming to you from the WellPoint Studios. WellPoint, the only health plan offering healthcare benefits exclusively to Massachusetts GIC members. At WellPoint, your whole health is their whole point. I'm so excited to have a very gracious guest on with us today. We have Darlene Bruen. She is the office manager at Today's Wellness and Primary Care. How are you, Darlene?
I'm great. Thank you so much for having me.
I am so excited to have you. We've talked on the phone, we've emailed, we had a great conversation off air, and I'm excited to bring it on air.
Thank you.
So can you talk a little bit about what made you join the chamber?
Oh, I would love to. I would love to. So I have a dear friend. Her name's Linda Gilbride. And when I told her that I was going to work for Today's Wellness and Primary Care, and we had locations in Wilmington, Stoneham, North Andover, and Dracut, she said, "Oh, you have to reach out to the Lowell Chamber of Commerce. You must reach out to them," which I did. And for those of you that don't know, Linda also is a member of the chamber.
Yes,
She's the owner of George's Textiles.
Yep.
Linda and I go way back. Our children, we raised our children together. We're now watching them grow in their 20-somethings. But my original introduction to Linda was before she actually owned George's, she was, and still is, an amazing seamstress. And she provided what I like to call the wedding dresses for my windows. And
so true.
I still have those draperies. They are timeless.
Yeah.
And her work, nobody can hold a candle to her work. And when she told me that, I'll never forget the day she called and said, "Darlene, I did it. I bought George's Textiles. I'm going to run my own business." I was over the moon for her, and she has grown it exponentially.
Oh, yes.
And for those of you that don't know, she does a lot of commercial work, right, with blinds and moving blinds and decorating and everything,
Yes.
and of course residential. But she's an amazing person. She treats her business exactly the way she treats her family and friends, with compassion, and always wants to do the right thing. So thank you, Linda, for introducing me to the chamber.
She's incredible. I've used her personally. We've used her to the chamber. My parents have used her.
Again, I can't say enough about, and her husband Paul and her children, just amazing people. I'm very grateful to have them in my life. So, but as a result of joining the chamber, I then got a call immediately, or an email from Rise Social Relations with Amanda and Rachel.
Yeah.
And
great.
They are experts in social media, building social media. And we've had one Zoom call, and we are going to have another meeting at our office.
Great.
And I hope to form a partnership with them.
Excellent.
And introduce them to our director of operations and some other folks in the operation. So already it's been an amazing experience. So thank you.
I'm so glad. That makes me so happy.
And the space is great.
Thank
my
you.
gosh, you're so lucky to have this.
We are so lucky. I know. Yes. And we talked a little off air about, you said you love what you do, and I feel the same way, and like how lucky to wake up every day and
be happy.
Be happy to go to work.
Be happy to go to work. Yeah. It makes a huge difference.
It really does.
Yeah.
So I understand that Today's Wellness and Primary Care is a primary care office.
Yes, ma'am.
Let's talk about that.
Okay, but will you indulge me just for a minute?
I will always indulge you.
In order to tell you how I came to Today's Wellness and Primary Care, I just want to give you a little bit of my background.
Great.
That will explain how I came to be. So I spent the better half of little over a decade, about 12 years, working for Winchester Hospital, small community hospital, does amazing work in Winchester. I worked for the Associate Chief Nursing Officer as her assistant. She was responsible for all of the inpatient care and nurses at Winchester, including the ICU. So a large part of the hospital.
Yeah.
And as part of my work with Marlene Williamson at the time, and then I was working with Pam Linzer when Marlene retired, that included doing a lot of project work when it comes to nurse-physician collaboration, patient experience, complex care, and how we handle complex care within the inpatient environment. That work is how I got to know Dr. Mohammed Jaleel, because at the time he was director of medicine for Winchester Hospital and also practiced at Winchester. And then fast forward a few years into working at Winchester, Dr. Jaleel started an organization called New England Inpatient Specialists, and his organization sources and finds the doctors and amazing nurse practitioners that work in many of our community hospitals, including Winchester and Lowell and a couple of others. So, so that was again part of his role, providing the amazing doctors there and nurse practitioners. So as I was doing that work, it became very clear to me how passionate Dr. Jaleel is about his patients. And it became very clear to me, the more I stayed there, the more he understood what's important for our patients. So let me just take that a little step further. When you go to the hospital and you're hospitalized, the number one goal is for you to get home well. It's not to go back. It's not a hotel. Absolutely. They're not saying, hey, come back, we're going to have a special someday. No. It's to get you out of the hospital, get you well, so that you can go to that hotel with your family, so that you can go to the soccer field with your son and watch him play his first game, or be at a PTO meeting, or run for school committee, whatever it might be, right? You need to be home and well, get you out of the hospital. So how do we keep you out of the hospital? You stay out of the hospital because the next step that you make or should make is going to see your primary care physician. Unfortunately, what was happening is many people were closing up shop. It's a tough business to run. And people were just saying, you know what? I can't do it anymore. At a time where people were running away from it, Dr. Jaleel said, well, wait a minute. No, we need to take care of our patients. They need that complete care coordination. He saw that there was a hole being left and could not leave that. Wow. And first of all, that speaks volumes of the kind of person that we're talking about, right? And it is about care coordination. So when you leave the hospital, or say you even weren't at the hospital, you need to have a PCP office to go to, right? So he formed Today's Wellness and Primary Care. First one opened maybe 6 years ago in Dracut, and subsequently now we have 4, as I mentioned, in Stoneham, Wilmington, North Andover, and Dracut. And what drew me to all of this is because the philosophy within Today's Wellness and Primary Care, again, is care coordination. So you come to our facility, regardless of who you see, whether you see one of the amazing doctors that, again, Dr. Jaleel sources and hires, right? He had already, still does that for local hospitals. He knows how to do that. He brings people together that have, some of the people that work in our group have 30 years experience in the medical field, but by design, some of them do not. And why that works for our patients, when you bring all of those people together, they have different perspectives. And now you've watched Grey's Anatomy, right? Most people at home probably have watched Grey's Anatomy or some doctor show where you see them do rounds or grand rounds. At Today's Wellness and Primary Care, that happens every Wednesday via Zoom. Every single doctor is in the room via Zoom to talk about different cases in the practice, or to learn. It could just be a learning experience, or it could be, hey, I need some help with this. Let's talk about it. I need to get, some movement for my patient in this particular area. And they share all that amazing brain power.
That's incredible.
And years of experience and years of, and again, the younger folks, I shouldn't say folks, now I'm dating myself.
You're not dating yourself.
So the younger group of physicians also brings such an amazing perspective for things that maybe the older physicians or people who've been practicing longer haven't seen. So that is just absolutely, that's one of my favorite parts of our whole week, right? But again, complete care coordination. So you go to your PCP, You choose your doctor. We have plenty of folks to choose from.
You are accepting patients.
Which is rare.
Huge.
We are
Yeah.
accepting
Yep.
patients, and even if things are crazy busy, we would never tell someone no if they're looking for a
Yeah.
PCP. It just wouldn't happen.
That's amazing.
It just wouldn't happen. But when you walk through the door, I know some people worry about, well, if I come, I want to be able to see the same person every single time I come. And let's face it, the reality is that's not always going to happen.
Mm-hmm.
People have vacations, people have maternity leave, people have paternity leave, those things. That's life, right?
Yep.
People have life, and we want the people that work for us to have life. That's another important part of our organization. So you always can see someone else within the organization. But here's what's different. When you see that someone else, you won't have to worry about that they know nothing about you, because we have these meetings every Wednesday. We have our version of grand rounds. Everything is charted properly, so your history is in there. And 99.9% of the time when you walk through the door, somebody isn't going to go, well, I don't know anything about you. That's not going to happen. That's not our goal for that to happen. It's care. This is, again, part of care coordination. We work very, very hard to accomplish it. And our doctors are amazing. But there's another piece that I need to talk about that I also think sets us aside from a lot of PCP offices, besides the fact that we're taking patients. Our medical assistants. I want you and anybody who's watching from home to Google Certified Medical Assistant Exam. Then take a look at the questions that are on that exam. Not an easy thing to pass. Our medical assistants are certified. They know, they have their clinical down. They are knowledgeable. They are compassionate. They are eager to learn. Many of them want to go on to be nurse practitioners, physician assistants. Some of them are pursuing nursing degrees. And it is our hope that they'll stay within our Today's Wellness. We call it our village, right? Because we work in the hospitals as well, right? And Dr. Jaleel also works in many skilled nursing areas. So when you're ready for that,
Does he
point
sleep?
in your life, well, sometimes I wonder, honestly, because he, as I said, he practices not only in the inpatient setting, but he practices at our primary care offices.
Amazing,
you can see Dr. Jaleel for sure. But again, he's put together an amazing group of physicians that are also available. And I can't say enough about our medical assistants. They're usually the first person you see when you walk through the door. They're usually the last person you see when you're checking out. And if you go to different practices, you might see the same faces in different places. And not because we don't want continuity in one practice or another, but again, we're a family. So when somebody in our family needs to go on vacation, then we go to that location to make sure they can have their time off. Or if somebody's not feeling well, oh my gosh, the flu this year. And I know your son had the stomach bug. I'm sorry. I hope I'm not oversharing.
Oh no, I'm
was, so we, we're not immune to those things happening.
Absolutely. I mean, you're around it all the time.
And I mention it because that's why you'll see people in different offices, and it's good that there's still the continuity of care. Absolutely. But it's important that regardless of what door you walk through, whether it's, Stoneham, Wilmington, North Andover, Dracut, you're always going to have the same experience. That's our goal.
Amazing.
You're going to see someone who has a smile on their face, and if they can't help you with something, we will find someone who can help you. And the care coordination, I'm going to keep coming back to that because, we all have different doctors, right? Besides our PCP doctors. I know I have a lot of ologists, right? I have a cardiologist, I have a hematologist, I have a dermatologist, I have the ologist.
You have
list,
all the
right?
ologists.
I have all the ologists. But what is very frustrating is when you have that many list of doctors, to not have your own doctor know what those doctors are doing as part of your care. That, again, that is part of our care coordination at Today's Wellness. We know those things. We make it a point to know those things because it's part of your overall health and for us to help keep you healthy, which is the main goal. every day
Amazing.
of every hour.
Yeah.
And when the opportunity, so you originally asked how I came to be there. So obviously it was because of Dr. Jaleel, but came to a point at Winchester where I wasn't sure if I was ready to, retire or do something completely different. And then a friend of mine said, well, you should really talk to Dr. Jaleel. He might have some ideas for you. So we talked and we talked again. And I am so grateful that he let me be part of this amazing organization. I get up in the morning filled with joy to do what I do and to work with the people that I work with. And is it a lot of work? Of course it is, right? But it's amazing. Yeah. I love it. I love it as much as the work I do in Woburn for my constituents.
You are on the Woburn City Council.
I am. But it brings me great joy to help people, and I get to help people doing this. And I want to help. We want to help more people. Speaking of ologists, I was at one of my ologist appointments. And she said to me, oh, gosh, I heard you left Winchester. This is a few months back. And I said, yeah, I did. I'm so excited. I told her where I was working. She said, are you guys accepting new patients? People ask me all the time that they can't find a PCP. And I said, yes, we are indeed accepting new patients. But it makes me sad to hear that people are being turned away because it is the most critical part of your healthcare to have that one group that can pull your care together in that full circle. That's what we do. We want to do it for as many people as we can.
Yeah, and that can be discouraging if you have an ologist.
Probably somebody's going to get mad at me for saying ologist, but the older I get, the more ologists I have, and I'm so grateful for every one of them.
All of them. But refer somebody to a PCP, and then they call and they're like, "Sorry, we can't."
That happens more times than not. Yeah, and again, that will not happen.
Yeah,
if you call us, and I hope people will at least look into us. If they can call me personally if they want to talk about it. All I know is I consider myself very grateful to be part of this organization.
Oh, you can tell that you care, the passion.
I love it. Yeah. I love it. I love our patients. And I just started back, I guess in September, and I've already gotten to know many of our patients, and it brings me joy when I see them. And I'm not clinical. I'm not. I just get to work with amazing clinicians. But it makes me feel so good when you see them walking out the door feeling well and feeling confident.
Feeling heard.
And feeling heard. We listen to our patients. And, half of the battle out there today is, understanding how to put those pieces together. Yeah. And that's part of what we do. Joyfully.
Yeah. Oh, thank you.
No, thank you for having me here.
Yeah.
Thank you.
So can you say your locations one more time? We know you're accepting new patients.
So Stoneham, Wilmington, North Andover, and Dracut. And again, you can, whether you're close to Boston or and you don't have to stay at one location.
Okay, great.
Because our doctors, obviously practice it. Some practice at all, some practice at just two. So it's up to you. It's up to you. We try to, we want our patients to be part of their healthcare decisions, and part of that decision is what's most convenient for me. So yes.
Yeah, and that can depend on where you work, where you live. So
and we have I'm sorry, I didn't mean to cut you off, but we have many affiliations with various laboratories. Yeah. And many obviously access to all of the ologists, the cardiologists, the neurologists, the hematologists, the dermatologists, all of that. We have a whole wealth of information and people that we've worked with, that Dr. Jaleel has worked with across the board at the organizations. And we're very particular, as we should be, because these are choices that our patients need to make, and we want to make sure they get to make choices that they're comfortable with. So that's it. I guess that's it. I could go on and on. I know.
Anything else?
No. But thank you so much for having me.
Thank you. This was so wonderful. It's nice to finally meet you in person. And I mean, right away, as soon as you said you were friends with Linda, I'm like, oh, we'll get along.
She's amazing, Linda.
Yeah.
Shout out.
Yeah. Well, we will have you back on anytime you want. So if you ever want to dive deep into something or bring on a physician,
Oh, that would be
yeah,
lovely. That
we
would be
love that.
lovely. Oh, I would love to do that.
Okay,
I'll take you
great.
up on that.
Excellent.
All right.
Well, thank you so much.
Thank you very much. Have a great day.
You too. And thank you all for tuning in to another edition of Chamber Chat. We'll be back again soon.